All right, I think we're going to go ahead and get started. We've got IQVIA team has quite a bit of information to get through today, so let's go ahead and get started. Again, welcome everyone for joining today's Congenital Heart Surgery Database User Group call for today, Tuesday, November the 3rd. On the call from STS, we have myself, we have Carol Crone. I think that's it from the STS side. We also have a couple of core group data managers on the call today. Representing the core group side, we have Chastity Wellness and Leslie Wacker. From the IQVIA team, we have Rhonda, Jeanette, Jean, Joe, and Melanie. So thank you everyone for joining me on the call today. In regards to our agenda, our standard agenda, we have our STS updates, and we'll turn things over to our IQVIA colleagues, and then we'll finish up with your user feedback and your user questions. All right, in regards to our STS updates, for those of you that are on the monthly call, this all looks very familiar. I'll run through these rather quickly. As you're all aware, the harvest submission deadline is extended. Again, it was originally scheduled for October the 16th. We are working on getting that harvest close date determined ASAP. And of course, that is all dependent upon the release of the primary procedure mismatch report, which Melanie will go over here in just a few minutes. So again, that harvest close date information will be coming soon, and please know that we will give you ample time to get that data cleaned up for that in regards to that harvest primary procedure mismatch report. For our AQO wrap up, again, all AQO sessions will be available on the platform for an entire year. Just a friendly reminder that continuing education credit must be claimed by December the 31st of this year. And also, if you were unable to attend the AQO meeting, access to the program is going to be available for purchase in late November through the STS Learning Center. So if you need more information on purchasing access to the program, please feel free you can either email myself, ljones@sts.org, or you can email Emily Conrad, and her email address is econrad, CONRAD, @sts.org. As you are all aware, we are in the we're in the beginning stages of our congenital data version upgrade. That upgrade is currently scheduled to go live January 2022. The specs will be sent to the vendors in July of 2021. We are in our first series of calls, and we are currently we are reviewing the pre-op factors at this time. Also, if you have any upgrade suggestions, please feel free to email those to me directly at ljones@sts.org. So please get those in as soon as possible, as we are currently reviewing the pre-op factor section at this time. Also, I just wanted to touch on a quick, from the STS perspective, just a quick COVID coding review. As you are all aware, temp code 6724 and temp code 6723 are currently being utilized for the COVID data collection. Again, just please review to ensure your cases are being coded correctly, as your improper coding could possibly change your outcomes or your analysis. So please review those cases, again, to ensure that you are coding those correctly. And in terms of abstracting these COVID-19 fields, just remember that in order to code, it must be a positive PCR test. We are not collecting data on antibody testing. Again, we are not capturing any data on antibody testing. Just a reminder to code no for patients who are not tested, and for patients who are tested for COVID-19 and that test is negative. Again, code no for patients who are not tested, and for patients who are tested for COVID-19 and that test is negative, code no. In those instances where you have more than one positive test, be sure to collect the test closest to the OR date. And just a reminder to enter the date, sequence 6723, for positive test only. We're not interested in a date for a negative test. Again, you would only enter a date for sequence 6723 for a positive test only. And again, these are just a few of the questions that we've gotten through the FAQ. Just wanted to touch on these again rather quickly. Do we really need to go back to January to extract these fields? And of course, the answer is no, but you can go back to January 1 if your site was impacted early on. Will these patients be included in outcomes? And again, per the previous slide, this is why we're asking you to ensure your cases are coded correctly. No, the record's coded as COVID positive, and that's, again, we're looking at harvest codes 11, 12, 13, and 14. So any records that have a harvest code indicated checked harvest code yes for 11, 12, 13, and 14. Those records will be excluded from analysis and public reporting. Can I abstract a patient who was assumed to be COVID-19 positive but was not tested? And of course, the answer to that is no. We only code yes for a patient who has been confirmed to have COVID-19 through laboratory testing. We're not going to work off of assumptions here. For COVID-19 after discharge, for patients that self-report testing positive for COVID-19 within 30 days of surgery, please go back and indicate yes after discharge within 30 days of surgery. Of course, if you have any additional questions regarding the COVID fields, we do encourage you to check the FAQs to see if your question has already been answered. If it's not, again, please submit your question via the clinical question submission form. All right, so that is all that I have in terms of our STS updates. I'm going to go ahead and turn things over to our IQVIA colleagues for their updates. Joe?
Great, thank you so much. All right, so let's go ahead and dive in. So a few items that are currently under review, starting with a couple for the uploader, SCS 4055. We are working with specific sites on a site-by-site basis who have reported this particular issue. The issue in question seems to be that the DQR is saying that more records were updated than the sites believe actually were. So if you are a site that has reported that, please know that we are still looking into it. Or if you believe that you are experiencing that, where the uploader is saying that more records have been updated than you actually believe you made changes to, please let us know and we can add you to that ticket. SCS 4295, autologous transfusion, is not updating on the case form. This was only reported to us by one site, but we did want to address it. We are reviewing the DAT file from that site and looking to determine what might be causing that particular issue. One item regarding the missing variable report. We received a report that the Humate P units dose 3 variable is appearing as missing in situations where Humate P units dose 2 is set to 0, and so that shouldn't come up as missing in that situation. So we are working to update the logic so that doesn't come up. And then one item in regard to the dashboard report, SCS 3873. We did have one site report to us that they believe there's a discrepancy between the total number of records in our dashboard and what they're seeing as their total number of records in their vendor system. So we are looking to make sure that the dashboard is reporting out that total number correctly on our end. And I think that's it. So if you do have any tickets that were not reported listed here today, rest assured that we are looking into those. If you want an update or if you want more information, you're always welcome to follow up with your ticket with your IQVIA agent and see if they can get an update for you. Just the last note here on this slide, we are targeting a new report for the November release. It is the Primary Procedure Mismatch Report. And so for that, we do have user testing in progress, which is scheduled to be released this month. For more information, I'll turn things over to Melanie, who will give you some additional details on the next couple slides.
Okay, thank you, Joe. Hello, everyone. It's Melanie. So let's go ahead and jump into that new report. And we can go to the next slide. Just a quick overview. This is a staple within our slide deck, just to kind of go through the checklist of items that are coming up. So for November, we have the Primary Procedure Mismatch Report. So I will do an overview of that. We also are planning on doing more in-depth review of that report. I believe the next upcoming CHSD session is scheduled for November 17th. So we also will be doing another review during that session also, just as a heads up. The next future report will be, of course, the risk adjusted, back one.
Sorry,
It's okay. The risk adjusted dashboard report. And that, of course, is going to occur after the analysis is done on the data that is submitted. So again, a future report. We are continuing to, of course, work through to make sure that you're able to get all of your data in and cleaned up. Once that harvest close date is set, after that's done, we will provide that data set over to DCRI. They will conduct the analysis and provide that back to IQVIA, and we will present that information in a new report. So that is, again, future state of what's coming. Let's go ahead and go to the next slide. So let's talk about the primary procedure mismatch. We'll start off with just the rules overview. And then what I'll do is take you to, and I provided the links here on the website, on this slide, to the STS website, where you're able to, of course, review the information that we'll be going over. So for this report, the guiding principle is for any operation, the primary procedure that's selected should be the highest stat score that should be selected. Of course, for those that have been working within a database and doing this for many, many years, they're very familiar with how this works. For those that are new, we just want to make sure that everyone is on the same understanding of how this report works. So there is an available chart or table. We usually are referring to that stat table, the Appendix C. And so the Appendix C was updated in July, and it is posted on the STS website. So the link is available here, and then I will show you where that's available on the STS website for those that may not be familiar. Another principle of the report is that if there is a tie of stat scores, the report will not present those instances where there is a tie. So basically what was selected by the user and what is basically coming up on the IQVIA calculation, it basically comes to a tie situation. Those will not display on the report. Those will basically take the selection of what the user had entered in on the operation. And the other concept of this report is that there are exclusions that are considered, and those exclusions are available again on the STS website. So these are the rules that go a little bit deeper in regards to how those codes are then interpreted in regards to the scoring. So there may be some exclusions where there are preferences and how those scores are then determined based on these rules. And so those are also available on the STS website. So what I'll do now is just go ahead and do a screen share. So Leanne, I'll go ahead and share my screen.
All right, I stopped sharing mine, so you should be able to take over.
Okay. And just let me know if you're seeing, you should be seeing the STS congenital page.
Yes, ma'am.
All right, perfect. Okay, so again, those links are available within the slide deck, but I just wanted to at least give navigation so you are able that. So if you were to access the registries, STS National Database, so I'll just click on that so you can see. We'll just go through it and you can see where we're headed. Oh, I didn't mean to click right on that link, but let's go here, STS National Database. And then we would go to the congenital, or right here, you'll see that underneath where it says STS National Database, congenital heart. Okay, and then access data collection resources. You'll see the available versions. You want to click on that caret and go ahead and expand underneath the version 3.41, you'll see where there is a hyperlink under the additional resources for the Appendix C and also for the rules to determine primary diagnosis and primary procedure. Those are available here. I do have those tabs open. So let's take a look at here. So this is the Appendix C, and this is the table that the report will generate and basically compare against. It uses all of this information that you see here in regards to the actual procedure harvest codes that were selected, the assigned stat score. It looks at that information and then makes the determination on what is the highest stat score. And then again, there's additional considerations in regards to the exclusions. And those exclusions, those rules, are available within this documentation. So this was the other link that I just made reference to, which is here, rules to determine primary diagnosis and primary procedure. Okay, so I already had that open. So once you scroll down, and really, I'll just take you back here on page 1, I just emphasized the guiding principle on that previous slide that we reviewed, and also in regards to how ties are handled within the system. So we basically are taking this document and these rules, and we're generating the report off of that. So through this UAT timeframe, and if there are data managers that are participating in that UAT, we extend many, many thanks to you for just the time that you've taken and also your feedback. It's been very impactful, and we appreciate just all of what you've done during this time frame. And so from that feedback and from the analysis of having all of these different sites go in and generate the report, we're able to get different ways of how sites have been coding, different combinations of how they're coding, and how the rules are interpreted. So with that, we've been able to incorporate that feedback, and there are additional enhancements that will be added because we noticed that within this documentation, there were additional updates that were also required. So for example, we'll take rule number 1. For exclusion number 1, of course, there is the guidance that indicates that we would need to review the procedure specific factors, these codes that are listed here. So as I scroll down, there are some codes that actually should be added to this documentation but has not been added. And through, again, the testing, that type of information came back up to say there are additional codes that should be considered. So one of those codes is the Kawashima procedure. And so we are looking at making sure that we update, and this documentation that you're seeing here also will be updated, but that code has been added on the form, for example, but it was not updated on this rules requirements document. So this is also going to be updated. Another set of codes that also should be considered are the hybrid, I believe they're called, let me just double check. It's the hybrid approach stage 1 codes. I believe we have 3 that also should have been included, so that also will be updated. So the initial launch of the report, when we allow it to be enabled within the production environment, those codes will not be immediately available, but we will be adding those for consideration. We will be providing a list of all of this information at the time of the launch so that you're aware that you may see scenarios in which the Kawashima is not being considered during that initial launch, but we will make sure that we specify those scenarios, and of course make sure that the documentation that also is available reflects the same. Okay, so what I want to do now is let's go ahead and let's take a look at the report. So let's go into the application, and I already have that open. So I've already logged in and I'm in a test environment. This is just a demo environment. So let me go ahead and select the report name. And when we launch this report officially, of course, the name already has the report listed, but a new tab is going to be enabled. So right now you do see this in production, but currently you only see one report, which is the case mortality eligibility report. When this report is enabled, you're going to see two tabs. So I'm going to point that out once we log in, once we load it up. So I'll select the reporting period. I'll click Apply Parameters. And once the report loads, what I want you to pay attention to is down at the very bottom left, a new tab will be enabled once the report is live in production. You'll see that it will be listed as Primary Procedure Mismatch Summary Report. And once that report generates, you'll have the option to filter by surgery year. I only have data that's loaded for 2018 and 2019. So that is why I only see those 2 years at the moment. Even though I selected a time period that included 2016, I don't have that in this demo environment. I only have 2018 and 2019. So just wanted to call that out. And then you'll see that there is an option where I can filter on patient ID. If I wanted to type in and hone in on a specific patient, I am able to do that by typing in this field, and you'll notice that you have a search option here. And then you do have an option where you can just click on the patient ID, and that will also just bring back the results for that single patient. Another thing is you're able to filter by data version. Currently, I have records that fall into the 3.3 data version and also 3.41. So if I only wanted to focus on either one of those, I would just deselect to only hone in on maybe 3.41, for example. Another thing that will be added to the report, and again, this is another enhancement, and this came out of the discussions with the beta testers, is that we would add an additional filter to only display or allow you to filter on cases that are just op type 1 and 2. Currently, the report will display all op types. Okay, so that is another enhancement that will be coming. So for the results, you'll see that you have your surgery years listed, and then the surgical date ranges. You'll have that information here. And if I wanted to get the results for, let's just say, surgery year 2018, I would just select that cell. If I wanted to get all of the results for both, I'm able to highlight and select both cells, and that would give me the full list of cases for all years. Okay, so for both 2018, 2019. Other thing I wanted to point out are just the report notes. So we will have additional education that will be available, a report overview that will be posted so that you're able to have additional reference material for this report, and that will be available in the library. And another note that we wanted to make sure that was clear is that the primary procedure that's selected within your software system may not match the primary procedure that is ultimately assigned by DCRI. So we are, and that's of course at the time of analysis. So in situations with the data inconsistencies or missing data values, they actually do an additional data cleansing step. And in some instances, they may even impute variables during that time of analysis. So in regards to the ultimate assignment, it may differ when it goes to DCRI. But again, we're following the same rules and exclusions that are listed again on that document that I showed earlier. Okay, so this is just a quick glance at a comparison that is available within this demo site that I have. You'll see that you're able to, let me just go through a couple of the columns that are available for you. The data version, surgery year, operation ID, the patient ID, and this is easy reference for you to be able to go back to your software vendor system to be able to find those actual case operations and review the full list of codes that are selected for that operation. You'll then see the participant primary. So this is what was selected by the user. You'll have the description of that actual code. And then you'll have the STS primary of what is being recommended based on the concept of highest stat score. And then again, if there are any rules that are applied, then this is the ultimate assignment that comes back and presented. And you then have the description. And if you wanted to view the case within the platform, you're able to navigate to that case by using this hyperlink. Okay. So I'm going to go ahead and stop here. And I think I see a lot of things that are coming down in regards to potential questions. So we, of course, we'll get to that soon. But we will plan to have a deeper dive and allow for more specific scenarios with the rules so that everyone is on the same page on how the primary procedure is being selected. Again, when you look at this report, it is only giving you that snapshot view in regards to what was selected by the user, and then based on the report logic, what's being presented back as the primary that should have been selected in that scenario. There potentially could be many more codes that are selected with that operation. So it looks at the full list of the codes and it applies that report logic to then come back with this determination. Okay, so the next go round when we come back together to talk about this report, we'll look at some scenarios to make sure that everyone understands how it correlates with the different rules that are available. Okay, hopefully this was very helpful. And again, once this is available in production, there will be communication regarding the availability of this report. Okay, so I will stop here, and Leanne, I will turn it back over to you. Well, actually, I think I have the harvest checklist, don't I?
Sorry, I was on mute. Yes, ma'am.
I was about to get scared. I was like, my internet just went down.
No, you're good. So here we go, Mel.
All right.
I'm sharing my screen again.
Okay, let's see. It's not coming up for me as yet.
Carol.
Oh, it's coming up.
There we go.
It's coming up. All right. Oh, you thought you got rid of me. I'm back again. So let's talk about the harvest checklist. Okay. So I know that we've reviewed this, but maybe we have some newcomers. So let's just talk about the steps that you should do to get ready for harvest close. So of course, the first thing, and everyone is doing this, hopefully, is to make sure that you're uploading your actual operations. You're having those loaded to the system, and at the time of when you're uploading, you will be able to, of course, view your data quality report. So that's the first step in this process. Second step. First step is upload those files. Second step is review the data quality report. And the initial thing to review is if you encounter any critical errors, you want to make sure you review those critical errors. And that's if you encounter those. That is not given that everyone is running into a scenario where they're encountering critical errors. So you want to make sure you review and resolve those so that the records are able to be saved to the database. Always know that if you encounter a critical error, the record is not going to save to the database. After you've done that, the next thing that you would do is review any errors or warnings and resolve those, specifically errors, okay? If you need to go in and just, of course, do a deeper dive and take a look at those errors and make sure that those are addressed. A lot of times the warnings are informational. We're not telling you to ignore them. Please review those also. And if there are things that you can do to take action on it, one example is if you're seeing where there is a mismatch in data versions and you're able to, and that's specific to the demographic data version, if you're able to update that demographic data version, then you could go ahead and take that action and that would resolve that warning message. Okay, so that's the data quality report. The next report that's available is the critical summary report. And the critical summary report is just an additional tab within the data quality report. And what you could do with that report is take a look at your total number of records that were submitted to the data warehouse. We always get questions in regards to how do you validate the total number of records that were submitted. You're able to get that number using the critical summary. And in that, you're able to determine which records were successful, which records failed, and if there were records that basically had no updates. Okay, so everything stayed the same and there were no updates. You're able to see that information on the critical summary report. Okay, let's go to the next slide. The next report that you're able to review is the harvest summary report. And the harvest summary is going to allow you to enter in a surgical date range. And in that date range, you're able to see in real time if there are any outstanding errors and warnings, okay, for that specific surgical date range. And so when you think about the data quality report, that is by submission. So you're able to see the errors and warnings that are associated by a specific submission. The harvest summary report will allow you to enter in a surgical date range and you're able to see all of those records within the database and then take action on any outstanding errors and warnings. The next report that you're able to review is the missing variable report. And here you're able to determine, do you have variables that are key, especially when it comes to analysis? Are you missing any of those? And how many of those cases are encountering variables that are missing and the items that you need to take action on? If you do see key fields that are missing, you're able to, of course, make those updates within your software vendor system. And at that point, after those corrections are done there, export the file and then re-upload that file to the IQVIA platform. That information will then update in the system, and then you could rerun the report to see that those cases basically should no longer appear on that report. Okay, let's go to the next slide.
Hey, Melanie, just real quick before
Sure.
We move on to the next report, I know I'd seen the question come through today, and I'm sorry but I thought this was important. And we often get this question a lot: is why are the critical summary errors not included on the missing variable reports?
The critical summary errors are
okay. Like the participant got a critical summary, got a critical error because one of the fields was missing data. And she wanted to know why was this also not showing up on her missing variable report when she ran that.
So, all right. And that's a great question, because I think that we need to have a clear understanding in regards to when you're doing an upload and you encounter a critical error, those records are not saved to the database. So those records, by the time if you did not resolve that issue with that record is still not in the database. So when you go to the missing variable report and you execute it, it's not going to pick up that actual record because it's not saved to the database. So you will never encounter fields that are critical per se on the missing variable, because records that encounter a critical error are not even available within the database for it to be picked up. Does that make sense? Is it clear? Yeah. Okay. Perfect. So that is the reason why you're not seeing that on the missing variable report. Okay. And of course, if we have any more questions like that, please put them in the chat and we will absolutely make sure that we can get to it. So let me get through this next slide here. And I believe we have one more after that, and we basically can almost wrap it up. So the next report, which you have access to now, is the Case Analysis for Mortality Inclusion Report. You will, of course, use your predefined surgical date range, so that drop down that's available. And what this report will do is identify cases that are ineligible, and it's due to specific fields that are being reviewed. And so if those fields are missing, it is going to display those cases as being ineligible, and it's going to list the fields that are missing for each of those cases. It'll let you know specifically you're missing this field, and this is why it's coming up on the report. So that report will basically give you that, and it's the mortality fields, if I remember correct. There are other key fields, and on the report, it does indicate those specific fields. So once you are able to update that information and re-upload the files, then it will resolve those cases on that report. Okay, and then the report that we just reviewed, the Primary Procedure Mismatch Report. So we just did a walkthrough of that. So basically it's going to give you the instances where there are cases where the primary procedure that was selected basically does not meet the concept or that guiding principle of the highest stat score, or it's not meeting one of the exclusion rules that have been applied. So it's going to present that list and then present what should be the suggested primary. Okay, and let's go ahead to the last slide for this, which is going to be the dashboard. So this now is looking at the entire picture. And basically looking at everything on this report to be able to then determine, based on the criteria that you put in, right, those actual report parameters, it's going to allow you to then take a look at specific areas of the op types, the mortality status at hospital discharge, operative mortality, to be able to get those counts and have an understanding of where things are in the current state of the data that has been uploaded. Again, this is the non-analyzed data that was uploaded to the platform, and it is real time. So each time you go in and you do an update, then it basically will update the information that you have within the system. And then once, as stated earlier, once that information after the harvest close happens, once that information is sent to DCRI, there will be an additional report, another dashboard report, where that will be based on that snapshot in time, that harvest set that was sent to them. That information will come back and we'll be able to present that in another report. So hopefully all of these steps are helpful in your process. But of course, if you have any questions, please put them in the chat and we'll make sure to get to you. I think that's the last one, Leanne, so I'm going to pass it back to you.
Great. Thank you, Melanie.
You're welcome.
Great presentation. Thank you so much. These last slides, our closing slides, you all are very familiar with this, so I'll run through these rather quickly. I see we have several questions starting to come in, and I want to make sure we have time to get your questions answered. IQVIA support plan, you're all familiar with this. Just again, friendly reminder to please include your participant ID in all communications with STS and IQVIA. It just makes our lives a lot easier. Again, just please be sure to include that 5-digit participant ID in your contact with STS and IQVIA. Again, here we just have a list of resources available to you out on the STS website. We have our contact information, webinar information, support document, training videos, as well as a direct link to the IQVIA data warehouse. Again, my contact information, if you need to reach me, feel free to reach me via email or phone. My information is listed here. Also, if you have database operational questions, questions regarding your contact updates, questions regarding participation fees, and questions regarding your participation agreement, please feel free to reach out to us at stsdb@sts.org. If you're not sure where to send your question to, just please feel free to email me directly. If I can't answer your question, I will make sure to get you in touch with the appropriate staff person to get your questions answered. As Melanie had touched on earlier, our next monthly webinar is the November 17th webinar at 12 p.m. Central. Please be sure to put that, make sure your calendar is updated. As Melanie said, she'll go a little bit more in depth on the primary procedure mismatch report, as that will be in production by that time. Also, we have our next user group call is December 1st at 12 p.m. Central. Next, we're going to turn things over to you guys for our Q&A portion. Again, for your questions, please submit those via the Q&A function. So with that, we are going to go ahead and start tackling some questions. So if everyone's ready, let's see here. Our first question, when will congenital harvest in 2021? That's a great question, Heidi. We have not yet scheduled those harvest dates, but we will be working with the task force to get those dates on the calendar. We're working with the task force and IQVIA to get those dates on the calendar, but we have not set those in stone yet. So as soon as we have those dates established, we will send out a notification and post on the website. So again, that will be coming soon. Our next question regarding the COVID codes, patient that had a positive test for COVID-19 prior to surgical admission, code 11, but have since recovered, tested negative for COVID-19, will be excluded from analysis. I don't know, Carol, if you could touch on this one. You're a little bit more familiar of what's happening on the analysis side.
Yeah, I was just pulling this up because I know that we've addressed it in adult cardiac, so I wanted to make sure we were answering it the same. So what we are instructing sites to do is to use the testing closest to surgery. So if your patient has had a subsequent test, even though they had tested positive, and then they have another test just before being admitted for procedure, you would code the test just admitted for procedure. And I think that should be in the training manual.
If not, the training manual.
Yeah, it should say if there is more than one positive test date, collect the date that is closest. And then there's an FAQ, and if it's not in, then we could use the FAQ. Let me just make sure. Well, I'm just making sure I'm answering it correctly.
You're fine. Do you want me to move on to the next question?
Yeah, move on to the next one.
Okay.
Just make sure we have it correct.
Okay, sure. All right, our next question for our IQVIA team, it looks like a comment. It would be nice to enter this harvest surgery date range in the primary procedure mismatch and mortality eligibility summary report. So she has 1/1/16 through 6/30/2020.
This is Jeanette. We'll discuss that with STS and assess that change. Thank you for the suggestion.
Thank you, Jeanette. Thanks, Diane. Let's see here. Our next comment. DCRI has the algorithm to determine primary procedure. Is there a reason why the DCRI algorithm was not utilized? The algorithm is being utilized. It's very things. I don't know how to explain this, and I know IQVIA can explain it a lot better. It's not just a simple copy and paste when using the algorithm that's used at DCRI. I don't know if the IQVIA team wants to expand on this.
I can absolutely.
Yeah, go ahead. That's all you, Mel.
This has been my baby. So
that's all you.
As Leanne stated, and so we actually worked in conjunction with DCRI in regards to just the concept of the report. We cannot use the same code per se or their algorithm. They use different programming language than we use. But with that said, they also do additional data steps or data cleansing steps that IQVIA currently does not do. We do not clear values. We don't set values to missing. We do not impute the data values also. So there are many different steps that they do where we don't. And they have to do that in regards to getting the data prepared for the analysis step. So with that, we had to take a different approach. But basically, we'll be getting the same result. And in conjunction with working with STS and DCRI, we were able to go through all of the rules and how those rules are managed and prioritized. And we were able to execute our implementation that way. Hopefully that clears up a little bit of how the report works, but it's not a copy paste.
Great. Thank you, Melanie. If only it were as easy as it seemed. We're working on it. Okay, Carol, were you ready for follow-up, or did you want me to continue on?
No, I can take this one, and I'm also going to put the answer in the chat box. So at this time, the surgeon leadership would like any positive test, regardless of the timing when it was positive, to be coded. If there's more than one positive test, you'll code the positive test the closest to surgery. Those cases will be excluded from analysis at this time, but surgeon leadership is going to review the data on the COVID-19 patients and then make further recommendations regarding the exclusion or inclusion of previous COVID cases in the future. So I'll put that in the chat box, and I'll also put an FAQ that we had from adult, so folks have that.
Great, thank you. And I'll get that added to the congenital FAQ that's going to be posted this week. Thank you so much. All right. And then Jennifer was commenting off of, is it the harvest date range 7/1/2017 through 6/30/2020? I was going to ask about that too. I think the date range is wrong. The congenital database follows a 4-year reporting period. So the date range, the reporting range will be 7/1/2016 through 6/30/2020. Just a reminder, the general thoracic follows a 3-year reporting period, and the congenital is a 4-year. I don't know if anyone else had anything to add to that. Mel, anyone from your side?
That is in line with what can be selected for the mortality eligibility summary report that is available now.
Great. Thank you, Jeanette. Our next question, how does the primary procedure mismatch work with the long list versus the short list? So DCRI and STS work off of the, I guess, what you all would refer to as the short list. That is what is available in the data specifications. I believe other vendors, I think it's just Cardio Access, I'm not sure, works with what they call the long list, which is a more detailed list. And if you select something from their long list that's not in the current data specifications, I think it maps to something directly. I think Chastity has the long, Chastity, I don't know if you wanted to touch on that, as you are more familiar with how the long list versus short list works. But IQVIA and DCRI and STS work strictly off of what's in the current data specifications and on the data collection form, which is what most of our sites work with, is considered the short list.
Yes, Leanne, this is Chastity. So if you code with the long list, your long list terms map to the appropriate short list terms. So all that's being harvested from the sites that have the long list is the same short list terms. We have an added step of making sure we're not selecting something that goes to like a cardiac other procedure or cardiac other diagnoses. But we just get a little more granularity locally at our sites for using the long list. So primary procedure mismatch should be fine because your long list terms are mapping to the appropriate short list terms. All IQVIA will see are the short list terms that your long list terms mapped to. And so you'll be able to see the appropriate mismatches. Does that help answer the question?
I think so. Thank you very much, Chastity. Appreciate that. All right. Our next question, will there be documentation to explain the differences between the IQVIA procedure mismatch report and the algorithm used by DCRI?
So this is Melanie. I can speak to that. So not necessarily, I guess, it wouldn't be, I guess, I'm assuming that you're not talking about the technical aspect of how it's done. But we will provide documentation in regards to how the report rules are
Mhm.
generated within the report. So in your previous DQR, I believe DCRI indicates where they set certain variables to missing. That information is already provided in a previous DQR, but we will provide documentation on how we are generating the rules execution for the report. Hopefully that will assist with, again, guidance on how to interpret the rules and how it's being applied in the report.
Thank you, Mel. Thanks, Melanie. Okay, our next question. I noticed in the mortality analysis summary report that under pre-op factors, they count other pre-op factors. Wouldn't it be more useful to just count the pre-op factors that are included in the risk adjustment model?
I don't think I
have
understand that. I am not sure, and we will have to pull up the information, but we'll have to take a look and see. I'm not familiar with specifically what is being referenced here.
If you could please provide more context on that suggestion and submit it to the STS tech support inbox, then we'll be better able to follow up on that suggestion.
Yeah. Perfect, thank you. Let's see here. MC 30-day appears in the MVR for inpatients. I don't know if you guys.
Hey, Leanne, it's Leslie.
Yeah.
That is because it's just missing, and there's no parent for mortality at 30-day, so you can answer that even if they are in the in-house.
Right, perfect. Thank you, Leslie. Let's see here. In the mortality analysis, can we have a category for assigned mortality to this operation? Carol, what do you think about? What are your thoughts on the assigned mortality to this operation?
I don't think you want my thoughts on this one because I don't know.
Okay. Yeah.
Do all software vendors include that field? Because it's not I know some vendors have some of these kind of extra fields that we all use to filter our data, but I'm not assuming that that's universal because it's not a field in the specs.
Right.
And even if it was a field in the specs, we would have to depend on the data manager to provide that. I don't know how.
Yeah.
Diane, could you provide some more context similar to what was suggested earlier? Because I think if you're asking that you assign it, maybe that's not quite what we're going for, but perhaps you're asking if IQVIA can identify if that is what is going to get assigned mortality.
Got it.
Yeah. Thanks, Leslie. Carol, thank you. What is the planned release date for the procedure mismatch report? I know it's currently in beta testing. I don't know if IQVIA can touch on that. I know it's we're working to get it out as quickly as possible.
This is Jeanette. We're dependent on approval from both STS and the beta testers, so we don't want to commit to a date until that's available. So certainly the target, as Leanne mentions, is as soon as possible. But we want to make sure that it is meeting the expectation of the stakeholders before it goes up. So thank you.
Yes, thank you. Yep. Let's see here. Would it be possible to put together a training for the primary procedure rules for the newer data managers? I think this is definitely something we could look at adding for a future education webinar. Yeah, I think it's a great idea. Absolutely. Thank you, Liz. That's a great suggestion. And we'll get that added to our list of future webinar topics for data manager education. Thank you. Let's see. I thought this harvest was actually supposed to be 4.5 years since we didn't have the spring harvest. The reporting period, the data in the reporting period will still be 4 years. It'll follow the same reporting period as the fall harvest reporting period. Our the programs and the models are set to be run on 4 years. So we can't change that to a 4.5 year. We have to follow how the models were created and how the programs were created. So our analytic period will keep with the 4-year analytic period. Let's see. The assigned mortality, Diane had just elaborated that the assigned mortality was covered in the prior DCR harvest report. We'll have to go back and review. To be honest, I'm not remembering this off the top of my head, but we'll have to go back and review this. So we'll have to get back to you, Diane. Melanie, not Melanie, I'm sorry, Chastity, Leslie, is this ringing a bell for you guys?
Yeah, there was a list of like all mortalities and then all database mortalities maybe, or all events and then maybe index. I'm not sure, but
okay.
They didn't provide the index mortalities. What they provided, because that was really a part of analyzing all of your data set, but they did provide discharge mortality, 30-day mortality, and database.
Thank you.
Mortality.
Yep.
Yeah, there you go. So yeah, we can work to get that included in the data quality report. So that is something that we have on the list to get added for future enhancements. Let's see here. Without an algorithm, it's impossible to perform analysis, let alone generate a national report.
Yeah, I'm a little confused on both of these next questions coming. I think the participants are making an assumption about what IQVIA is using to develop the primary procedure mismatch report. And I'm not sure, Heidi's assuming that an algorithm is not being used and that she sent another comment about it being proprietary. Well, first of all, the risk model, we publish those, so they're in the public domain. So that would mean that it's not proprietary. And if it were proprietary, STS would be the owners of it, and we could share it with DCRI or IQVIA, whomever we chose to share that with. So I would get rid of that thought. And then the next question is about how are we doing this? Isn't it impossible to perform analysis without the algorithm? So IQVIA does have an algorithm, and I'll let Melanie and Jeanette speak on that further. But the next question is also a little bit concerning about, is there a reason for primary procedure mismatch reports if it's not going to be the same as DCRI? Providing accurate data is of the highest importance. This could lead to inaccurate reporting of data. So I just want to, this is concerning, maybe I'm not fully understanding this, so I just want to clarify that something in this for you. The primary procedure mismatch is based off of a list of exclusion criteria and algorithms that go along with that. Sometimes when the task force makes decisions, they can include another exclusion, or they can change that criteria. That criteria is updated at DCRI when the analysis occurred. And this has happened, this happened previously when IQVIA wasn't involved. This is something that happened at the DCRI level. When you would get your original DQRs back, it would give you a list of the primary mismatch, primary procedures, and then it always said that there could be a difference when you got that data back after analysis. And the reason is because of those changes that may occur from task force decisions and things like that. And I'm going to let, so first, I just want to disabuse you of those thoughts that there's no algorithm or that IQVIA is making it up on their own, because that's not true. So I would disabuse you of that, and hopefully you won't go spreading that around. So, and now I'm going to hand it over to IQVIA to explain where they got that algorithm and how they're implementing it, and exactly what the exclusions and other things that we get from the task force, how that impacts their calculations.
This is Jeanette. I know, Mel, you've addressed this a couple times, so maybe I'll give this one a shot. So we are coming up on time, so thank you all for staying on the line a little bit. So there are rules that are published, they're documented, and we use the same rules that DCRI uses. So I'm sure all of you have seen that document, you've referred to that document. If you have any questions on that document, that may mean for you that it's not crystal clear. So we have, as was mentioned earlier on this call, we have worked with DCRI and STS to make sure that any items that we had questions on, any clarifications, were vetted by both audiences. We've certainly gotten great feedback and input from the beta tester community, and we've worked with some of the task force surgeons. So it is the same set of rules that are being utilized by both DCRI and IQVIA. And as Carol mentioned, there is the possibility that a change is identified as being necessary as part of the analysis phase. That has been part of the process for this program. It may continue to be part of the process. But this report, this view of the primary procedure assignments are utilizing the same rules that DCRI uses at this time. And though there may be adjustments in future, we'll work those changes together with both organizations collaborating on those updates. Mel, is there anything you want to add?
That went right to the point. But we're using the same, and we worked closely with all parties, all stakeholders. That's that Jeanette just stated: DCRI, STS, surgeon leadership. And again, it is the same set of rules, but at the time of analysis, if there are any changes at that point, that's where DCRI would potentially have a difference or a change.
Okay, thank you guys. That was a great clarification. Carol, did you want to take the last?
I do.
Okay, go ahead.
I do. Thank you. Thank you, Jeanette and Melanie. That was great. So Heidi is now asking about, saying that she thought DCRI was analyzing the data, and this is why she's confused, and apparently going, saying that how can we do anything to perform analysis without an algorithm? Her confusion is coming from the fact that IQVIA is not doing any analysis. They're providing you with a tool so you can understand what cases, how they are most likely and probably 99% likely to be assigned once they do go into analysis at DCRI. So I don't know, IQVIA is not doing analysis. They're providing you with the tool, the same tool that you had in your data quality report from DCRI. Jeanette or Melanie, did you have anything to add to that?
I think that was a great overview, Carol. Thank you. So DCRI is still doing the analysis, and there are some pieces of information that are pre-analysis that we are working to make available for you so that you have that visibility. And then the analysis will continue to be done by DCRI.
Thank you, Jeanette. Heidi, I appreciate your questions. I think sometimes you overlook into what's going on, and you ask questions in a way that accuse us of doing something wrong. And it would be most helpful if we could work together if you have a concern to address it that way, instead of making it seem as though we're doing something that isn't appropriate by using elevated terms. So I'm happy to answer any questions that you all have, but again, we have to work through this together, and I'm not sure that causing a dramatic scene or using language that isn't helpful is going to get us to that point together. So happy to answer questions about things, but I think we have to be mindful of we're all in this kind of moving towards the same point together. So thanks, Jeanette and Melanie, for providing that clarity.
Leanne, you're on mute.
See, I can't, it's been a long day. You guys missed my amazing closing I was just giving. Thank you all for joining. I know we're over time. Thank you to my STS colleagues and my IQVIA colleagues for joining me on the call today. If you have any questions, please feel free to reach out to either myself or Carol directly. We are happy to chat. Thanks everyone, and I hope you all have a great day.